Good evening, folks. Welcome. I'm David Searles. I work at Epilepsy Foundation New England, and this is another edition of our Wednesday webinar series. We're grateful for our partnership with GeneDx, and tonight brings us Kirsten Kelly with GeneDx to talk about genetic testing, some of the questions that we might have, and some answers that we have as well. So if you do have any questions throughout the presentation, we can go ahead and utilize the chat function. And at the end, we'll get to some of those. And then if you don't want to put it in the chat and just want to save it to the end, we can unmute and you can verbalize your question. But I'll turn it over to Kirsten for the presentation.
Thanks, David. So it's nice to virtually meet you all. My name is Kirsten. So I'm a genetic counselor by training. So I've spent a lot of time in clinic, in direct patient care with patients previously, and with families and patients undergoing a genetic diagnosis or receiving a genetic diagnosis, or who are interested in learning more about their own genetics or family history. Currently, I work as a medical science liaison with GeneDx. So really, I serve as a liaison between the healthcare providers and the diagnostic laboratory that's performing the testing. And I help them understand how to use genetic testing, the different results they can get from genetic testing, and how to discuss this testing with their patients, and potentially what are next steps after genetic testing. So I no longer see patients directly, but we do have a great team of genetic counselors at GeneDx who still able are to provide that service to patients, and who are dedicated to patient-facing care. So happy to be with you guys tonight. As David mentioned, if you guys have questions, please feel free to put them in the chat. And then we should have some time at the end where I can help address any questions you might have. Let me go ahead and share my screen. Okay. So like I said, my name's Kirsten. So overall tonight, I think what I wanted to talk about was I wanted to, again, do a kind of a brief review of genetic testing and genetics in general. I know my colleague Olivia spoke to this group as well a few months ago, and she went into much more depth around genetics and genetic testing. So her talk is a fantastic resource if you wanted a deeper dive there. I think I won't spend too much time on that tonight since she already did that. Also, I'm going to talk about specifically the genetics behind epilepsy and where genetic testing is useful in that patient population and the clinical utility that we see there. And then finally, kind of the main focus of tonight is I really wanted to address some of the common questions that come up around genetic testing, and what that means, and potentially, what are the results and what are next steps. Okay, so going all the way back to high school biology, right? I'll try and keep it brief. This was my favorite subject, but I understand that it's not everyone's favorite subject, so bear with me here. So if we scroll out, right, if we zoom all the way out onto a macro level, our bodies are made up of cells, right? Within every cell, we have this structure called a nucleus, and within that nucleus, we have these structures called chromosomes. And so we have 46 chromosomes in total, and we get half of those from our biological mother, half of them from our biological father. Within these chromosomes are our DNA, and that DNA, segments of that DNA are what we call genes. And genes are essentially, we like to say they're the instruction manuals for our bodies. So these specific genes, they tell our bodies how to grow, how to function, how to develop. We have approximately 20,000 genes that we know of contained in all of our DNA. And there's millions of different variations and different genetic codes that are within those genes. And sometimes what can happen is we have changes in these genes that can cause our bodies not to grow or develop appropriately or function appropriately. And those changes that cause that are typically what we refer to as a mutation, right? So we're actually moving away from that language of mutation. You might also hear it be called a pathogenic variant. Patho just meaning abnormal, right? So it's a change that adversely affects the way that that cell can function and the way that your body can function. And so when we talk about genetic testing, those are the changes that we're really looking for when we're looking within these genes. Another helpful analogy I really like to think of, if you think of these DNA and the chromosomes, our chromosomes are kind of like a spool of thread, and our DNA is wound really, really tight many, many times to make up these chromosome structures. And so I think if you unwound all of that, the length of our DNA is extremely long. There's a lot of information there, a lot of material. So if you've ever spoken to a genetic counselor, you know that we love a good metaphor. Okay, so another great metaphor I really like to use when talking about genetics and DNA is a book, right? So if we think of all of our genes, all of our DNA as one book, sometimes people like to say a cookbook, right? So that's the entire book. That's all of your instructions. That's the whole instruction manual. And then within the book, you have different chapters, and you can think of those different chapters as your different chromosomes. So they contain different instructions for different recipes, different material. Those are all contained on different chromosomes that you have. And then within those chapters, you have individual pieces or individual recipes, right? So if you have a chapter on desserts, you have individual desserts within those chapters, and those are going to be your genes. So they're much more specific. They're coding for very specific proteins or things in your body. And that's really what we are looking at when we're looking for these abnormal changes that we sometimes see. And so in genetic testing as a whole, there's a lot of different ways that we can look at our DNA or look into this instruction manual, right? And really the differences between these different types of testing is how zoomed in or how zoomed out are we looking at this instruction manual, right? So if we talk about, oh, sorry, jumped there. If we talk about whole exome or whole genome sequencing, which is primarily going to be the focus tonight, that's where we're reading through the entire cookbook, line for line. We're looking through all of those recipes, every line, we're reading through everything. Another type of genetic testing that's separate is what we call a chromosomal microarray. And this is testing that's been around a very long time. This is testing that's been done for many, many years. And before whole exome sequencing, it was kind of considered the gold standard of genetic testing. And this testing is going to look for any missing chapters. So it can't zoom all the way in to read line by line, but can tell you, hey, you're missing this chapter. Or sometimes, hey, you've got 2 of this chapter. So it's really telling you when there's large chunks of information either missing or duplicated within your chromosomes or within your DNA. And then when you zoom in a little bit more from that, we talk about single gene or multi-gene testing. So that's where you're looking at individual recipes. So you're looking at specific genes. So you're able to see more clearly, hey, are we missing certain instructions in this specific recipe? Is there something abnormal in one of these genes? And you're looking more closely there. So these is kind of just in general, different types of ways that we can look at the same information. And it just gives us an idea of what's going on or what could potentially be different in a patient's DNA. And then depending on the different type of testing we're doing, how often do we get a positive or a diagnostic result off of this testing? So when you talk about looking at individual genes or a list of genes, about 10% of the time, we find something in that patient's result that we say, hey, this is abnormal or this is different. This could mean they have an underlying genetic condition. When we look for a chromosomal microarray, so again, we're looking for large chunks of DNA that are missing or duplicated. we see a result about 10 to 20% of the time. We can see those changes in an individual. And then it's no surprise, right? When we do the largest test possible, this whole exome sequencing, where we're reading through every single line, we find something about 30 to 50% of the time, which makes sense, right? Because it's really the most thorough. We're reading through the whole cookbook, essentially. So we're much more likely to find an answer. Okay, and so why do we talk about genetic testing so much in individuals with epilepsy, and why is it so important? So epilepsy is common, right? Just over 1% of the US population has epilepsy. That's just over 3 million people, and almost 500,000 children. So that's a lot of individuals that have epilepsy. And if they have a precise genetic diagnosis, it can lead to a more effective and specific treatment. So when we think about precision medicine, this is something that's along those lines, right? If you know specifically why that individual has epilepsy, if there's that underlying genetic cause, you can be much more precise in your treatment of them. And it can also help you identify other co-occurring medical conditions that may come up, right? Because if we know that, hey, with this specific condition, individuals also develop this other medical condition, that's something that we can be aware of and potentially do screening or treatment for. And so there's a large portion of individuals where when we do testing, it has very direct and immediate implications for treatment and management of their condition. And what we've seen in some individuals who receive a genetic diagnosis is that they can have a severe reduction in their seizures. And a lot of times that's because we're able to give them very specific medication management guidelines based off of that genetic diagnosis. And a genetic diagnosis can also mean you have improved access to specific resources or even clinical trials that are ongoing. So there's a lot of different reasons why we talk about genetic testing in epilepsy and why it's important for these individuals. And again, this is just talking about when we do this type of genetic testing in individuals with epilepsy, we find an answer about half of the time. So in about 50% of patients, when we do this testing, we're able to find a specific genetic cause for why they have epilepsy or why they're experiencing seizures. And that's been identified in multiple different seizure types. So it's not necessarily specific to one seizure type and not necessarily specific to certain types of epilepsy either. And we see lots of different what we call inheritance patterns, right? So like I said, you inherit half of your chromosomes from mom, half of your chromosomes from dad. Depending on the specific genetic condition, sometimes it's something you could have inherited from one of your parents or potentially inherited from both of your parents. Or sometimes it's a genetic change that happens in an individual brand new. So it's not inherited from either parent. It happened for the first time in them. And so there's many different patterns that we can see when we look at the genetics in these individuals. And like I said, you know, certain genetic conditions as well can be associated with different types of seizures. And so it's important to know that information and be aware for these individuals. And again, why is it important for individuals to receive genetic testing? And how can it make a difference for them in their clinical outcomes? So what we've seen is that children with neurodevelopmental disorders over the course of their clinical picture can accrue thousands of dollars in health costs, and they can potentially wait for years and years and years before they receive a genetic diagnosis. And in that time, they can undergo numerous uninformative tests that are not giving them an answer. So in the genetics community, we like to refer to this as a diagnostic odyssey. And it really is meant to encapsulate, you know, what these families go through on the path to try and find a specific genetic diagnosis. And so the idea is that by doing the appropriate testing first, you can avoid a lot of this time you're waiting, a lot of this cost that's accruing, and try and shorten that odyssey as much as you possibly can for these patients and for their families. And there's numerous different benefits to genetic testing. The choice to do genetic testing is a very personal decision for patients and families. And it's something that they really should discuss with their providers and think about for themselves. We can talk about the numerous different benefits of genetic testing. One of them, like I mentioned, the faster you're able to identify a genetic diagnosis, the sooner you could potentially start specific treatments, which would increase the chance of a more positive outcome for that patient. And the sooner you receive a genetic diagnosis, you can connect that patient and their family with specific support services as well. Like I mentioned, you're able to end a patient's diagnostic odyssey by doing genetic testing if you're able to find a genetic diagnosis. Receiving a specific genetic diagnosis, you can also alert a patient or their family to other health concerns that may be associated with that specific genetic condition. So again, you can do additional screening, additional testing to try and be aware of all of that. And you can develop a more precise care plan as well, right? So if you know the specific genetic conditions, there's other individuals that have that condition as well. Medications that work well in those individuals or certain therapies or treatments that are very effective in those individuals. You can also avoid unnecessary testing or procedures or other appointments or follow-up if you know specifically what's going on. And like I mentioned before, with a specific genetic diagnosis, some patients may also qualify for specific clinical trials or medications. So like I said, there's lots of benefits, but again, it's always a very personal decision for a patient and their family, whether or not they want to undergo genetic testing and what that looks like for them. Oh, okay. And so for all of these reasons, we do have these larger governing bodies that do recommend this type of testing for individuals with epilepsy. So the American College of Medical Genetics, or ACMG for short, recommends this exome testing as kind of what we call a first line test. So you do it first for individuals with either developmental delay, intellectual disability, or congenital anomalies. And then off of that, the National Society of Genetic Counselors, or NSGC for short, that's the society I'm a part of, obviously, because I'm a genetic counselor, recommended exome as a first line test for individuals with unexplained epilepsy at any age, which is important as well, right? So not just in children, but an individual with unexplained epilepsy at any age, this testing is important and useful for them. And the American Epilepsy Society also endorsed that guideline. So clearly, these are large bodies that support this type of testing because they've seen the clinical significance and the clinical utility in this patient population. Okay, so now let's get to kind of the whole reason for that talk now that we've given that background. So what are some of the common questions that come up during genetic testing or some of the concerns that arise and how can we address those? So the biggest overall question is, what can I expect during the genetic testing process, right? What does that process look like? And what does this mean? So the first step in that process is that your healthcare provider is going to determine the appropriate test to order for you. As I mentioned before, right, there's different types of genetic testing. So your healthcare provider is going to determine what's the most appropriate test for this patient, this individual, and they're going to gather the relevant medical records or family history information that is needed, right? That's going to be an important part of that. So like I said, like we talked about before, there's different types of genetic testing, and they're all going to show you different pieces or different information about an individual's DNA. So you want to make sure that you're selecting the most appropriate genetic test for that individual. So that's a really important piece of the puzzle. And like I mentioned before, for individuals with unexplained epilepsy, typically that's going to be whole exome sequencing, where we're reading through that entire cookbook, right, to look for any significant changes. The next step is, okay, now I know what test is most appropriate and should be ordered. How do we do this testing, right? How is it performed? And typically that's either through a blood sample or a cheek swab. Those are the two most common types of samples or ways that we are able to perform this testing. So a cheek swab, or sometimes called a buccal swab, it's fairly easy to collect. There's these special tubes. They have a swab on the end of them. You wipe them around on the inside of your cheek. You shake up the tube, and that's pretty much it. And then you can send it off to the laboratory. It's fairly easy. A blood draw, I'm sure everyone's had a blood draw before, so you're familiar with that process, right? They just take a sample of your blood. Typically it's, one vial. There's not a huge amount of blood that we need to do that testing. They label it and they send it off to the laboratory. So sample collection is fairly straightforward. It's nothing too complicated. And we're able to do that genetic testing either from your blood sample or from your cheek swab sample. Sometimes your provider is going to suggest or say that along with the patient, we also want to include family members in the genetic testing. And a lot of individuals ask, why? If let's say, for instance, it's your child. If my child's the person who's having seizures or who's diagnosed with epilepsy, why do you need my sample or their biological father's sample? The reason for that is because an individual's genetics is not theirs entirely, right? It's familial. It's something that they inherited from both of their parents. It's really helpful for us when we're looking at an individual's DNA to also look at the individuals that they inherited that DNA from. And oftentimes, if we find a genetic change in that individual, being able to look at the parents and say, did this come from one of the parents? Are the parents affected? That type of information really helps us in determining, is this a significant genetic change in this individual, or is it, likely harmless and not something to be worried about? And so sometimes you'll hear them talk about trio testing. And that's really referring to when we test the patient, but then also their biological parents as well. So it's that trio configuration. And so sometimes you'll say, yeah, child got tested and their parents, and that's usually what they're referring to. The next step in the process, once you collect your samples, send it off to the lab, and they know what type of testing is meant to be run, what happens at that point? So the laboratory receives the sample, runs it through what they call their wet lab. So they run it through these large sequencing machines that are able to read through that entire cookbook and look for any of those changes. And then it gets passed off to usually human individuals. So there's not special AI that's doing this process. It's individual people that are looking through all of these genetic changes to determine, are these significant or not? And what does this mean for this individual? And then the lab will generate a report that has any significant changes that they identified listed on that report. Or if they didn't find anything, it'll say, negative or non-diagnostic at this time. And then the next step is that the provider who ordered that testing receives that report from the laboratory. And there's several different types of results that you can get from these reports from the laboratory. And I'll go into these in more detail in the next few slides. But in general, the first type is what we call positive or diagnostic. So we did find something significant in this individual's DNA. The next type of result is what we call negative or non-diagnostic. So at this time, we did not identify any significant changes in this person's DNA. The third category is what we call a variant of uncertain significance. Again, I'll talk about this in more detail later, but this means, hey, we did find a change, but we're not quite sure at this moment in time if it's significant or not. So we need more information. And then this last category is what we call secondary and or incidental findings. This is an important category. So because we're reading through that whole cookbook, right? Sometimes we find genetic changes that we realize don't necessarily have anything to do with the patient's epilepsy or seizures, but could be really important for them down the line and has really important medical impact for them. So it's something they should know about. And so it is something that the laboratory can report out if it's desired by the patient or the family. Again, I'll go into that in more detail with some examples. But in general, these are the different categories of results that you can get when you do genetic testing. So the next step, obviously, is based off of what type of report or result you get, your provider discusses those results with you and talks about, what does this mean and what are the next steps? So we're going to go through those categories together. So what happens after a positive result? So like I said, a positive result is where we did find a significant genetic change that is associated with a known genetic condition, right? So that's where typically we're giving a genetic diagnosis if you get a positive result. And so that will be clearly stated on the report. The provider will share that information and share that diagnosis with the patient or family. Sometimes, based off of that result, maybe there's other individuals in the family that also need to get genetic testing to see, hey, do they also have this genetic condition? Or is it just in this individual, right? Maybe the patient has siblings who could also have seizures or be diagnosed with epilepsy. And maybe we want to test them as well to see, do they carry this same genetic change, right? So sometimes testing of additional family members is something that's discussed after a positive result. Sometimes, as I mentioned, once you receive a genetic diagnosis, some conditions have other co-occurring medical conditions, right? So some genetic conditions are associated with epilepsy and seizures, but they could have other things associated with them as well. Sometimes an example is it could affect your kidney or your renal function, right? That's commonly seen in kids with this condition. So maybe we want to make sure that it gets screening and go to a specialist to get evaluated and make sure that there's nothing like that going on. And that maybe we just haven't identified it, but there could be something. And so sometimes there's follow-up testing or referral to specialists that's indicated based off of the specific genetic condition that's identified. And there's large databases out there that detail all of these different genetic conditions and what are the clinical features or what's important for families to know that have these genetic conditions. And then another important piece of the puzzle, right, is connecting patients and families to support groups and services, right? Are there other patients and families with this same genetic condition? Is there a support group out there? How can I connect with those families? I'm sure I don't have to tell you guys how important and helpful it is to be a part of a larger support network and support group. So that's a huge piece of the puzzle for families receiving a genetic diagnosis as well. Okay, the next type of result, what happens after a negative result? So this is when you get a report and they say, we didn't identify any genetic changes at this time that we think could explain why this individual has epilepsy or is having seizures. So what's important to understand about a negative result is that it doesn't mean that the individual's condition isn't genetic. It just means that the testing we did at this time and with the technology we have today, we couldn't find a specific genetic cause for that patient's condition. So there's always the potential in the future, as technology improves, which we've seen that genetic testing technology is continuously improving, and getting better and more accurate. We're able to identify more and more genetic conditions as that technology improves, as we test more individuals and identify more genetic conditions and more individuals with those conditions. There's potential that down the line, if we test that person again, at that time, then we might be able to identify a specific genetic cause. So as I said, a negative result doesn't always mean that it's not genetic. It just means that at this time, we couldn't identify the specific cause. What's helpful about a negative result, though, is that you have ruled out a lot of other genetic conditions, right? So we looked for many other genetic causes, and we've ruled a lot of those out with a negative result. So it is helpful in that respect as well. Okay, so a variant of uncertain significance, or a VUS result. This is the trickiest type of result. It's honestly providers and patients' least favorite type of result. Labs don't really enjoy giving out this result either, because essentially what it means is that we just don't know enough at this moment in time to know whether this specific change we're seeing in this person's DNA could be causing their clinical picture, so their epilepsy or their seizures, or whether it's a harmless change and it doesn't mean anything, right? Because if we compare any two individuals' DNA, there's going to be lots of differences between them, right? Because we're not all clones of each other. So all of our DNA is different from each other. And most of that is just harmless variation, right? It's normal. It's normal to have variation. Not everything should look the same. And so when you get a variant of uncertain significance, we're saying, hey, we did see something. We're not 100% sure if it's explaining the patient's clinical picture or if it's just that harmless variation. So what this means is that maybe we need to test other family members to help us figure out, hey, is this a harmful change or is this harmless variation? Or maybe we just need more time, right? We need to test more individuals. Maybe we identify this change in more individuals down the line, and that helps us determine, could this be associated with the genetic condition, or is this normal variation, right? And so sometimes that's a difficult result for families to receive because it sort of feels like, we don't know at this time. We sometimes have to wait and just get more information later. And like I said, the last category is what we call these secondary or incidental findings. So like I mentioned, these come up when we do exome sequencing because, again, we're reading through the entire cookbook. And so sometimes you stumble across something that you weren't necessarily looking for, right? It doesn't explain why the individual is having epilepsy or seizures, but it's really important for their medical treatment or their health. And so it's information that is important for them to know about. We only see this happen about 2 to 3% of the time. So it's not common that this comes up, but when it does come up, again, it is important information potentially for the patient and family to have. Patients and families can decide whether they want this information or not. So if they say, I only want you to tell me about genetic changes that explain, potentially the epilepsy or seizures, I don't want to know anything else, they're allowed to say that. And then this is not something that we would report out to them. Or they can say, hey, I do want to know if you find something else that's important for my health. And then it is something that we would report out to them. A good example of a type of secondary finding is if you guys are familiar with like the BRCA genes or BRCA, right? I'm sure those have come up a lot. So individuals that have those genetic changes, they're more predisposed to developing breast cancer or other types of cancer. And so sometimes that is something that we can identify. It's not why we did the testing. It's not really what we were looking for. It doesn't explain why the individual has epilepsy or seizures, but it's really important for that person to know they have that genetic change because there's screening they can do, there's prophylactic surgery, medications, treatments, all of those things that would be important for them to know about. So, like I said, this type of result doesn't happen very often, but it's something important to know that could potentially come up when you do this type of testing. So those are all the different types of test results that can come up when you do genetic testing. And so kind of the last step of this puzzle, right, is based off the results. Your provider may also suggest that you speak to a genetic counselor, right? Somebody who's specifically trained to go over this type of testing and go over these results and talk about next steps. So at GeneDx, we have a whole team of genetic counselors that are able to speak to providers or speak to patients and families and have these discussions in more depth and more specific conversations based off their test results and talk about, what does this mean for you and for the family and what are potential next steps that would be important in this process. Another really common question, and kind of the last question I'm going to talk about tonight is this genetic testing covered by my insurance, right? Is this something that I have to pay for? Is this something my insurance will pay for? What does that look like? So thankfully, what we see is that the majority of commercial health plans or insurances do cover this type of testing in individuals with these conditions, which is great, right? So hopefully there shouldn't be any additional cost to the patient or to the family. Depending on the specific type of insurance plan, some of them have really specific clinical criteria that has to be met, or maybe they want a specific letter from your doctor explaining why this testing is important, and all of those things. Again, that's going to be down to the specific insurance plan, what that looks like and what they require. But overwhelmingly, a majority of these plans cover this type of testing. And I think in large part that's because they see the value of this testing and they see the importance of this testing in these individuals. So that's all I had for you guys. Thank you so much for spending your evening with me and listening to me talk about this. My name is there, my email is there. That QR code is for my LinkedIn. Feel free to reach out to me on any of these platforms, but I'd also love to hear if you guys